A very warm good evening to each one of you who's taken up the time today to join us. It's a topic that has been, asked a lot on all our support groups. New parents are often, in fact, often, nahi, always perturbed by handling, newborns and infants and how to make them sleep, how long should they sleep, what is the best place to make them sleep. There's so many questions, and it's not as easy as it sounds. Like babies will sleep all the time and that's what you think you are getting into when you have a newborn, but things are pretty different, and once you have the new baby you realize how different they are. This topic is something that has been asked of us for a very long time. People have been telling us that please help us out with this, and that's why we planned this webinar today with our very own Sushma Jethmalani ji. She's an expert on all these topics and more. She's a qualified childbirthing and lactation educator, and she has years of experience in helping new parents make the best of the situation. So, very warm welcome to you, Sushma ji. Thank you so much for giving us your valuable time.
Thank you so much.
And
thank you so much for a very warm welcome.
you're most welcome. I'm looking forward to the webinar today. I think all of us are going to learn so much out of this today, and hopefully it will help the new parents who've joined us to be able to navigate this phase better. So let's start. Can we have the slides show on, please?
Okay, so first of all, thank you so much, Saloni. And this webinar is brought to you on behalf of ReeLabs, which is a stem cell bank. Okay, stem cells are something we all have heard a lot about it, but we are still quite new to it. But stem cells are something which can, sort of help you in, sort of fighting future diseases, future illnesses, which may actually help your baby, which may help the parents themselves and even the grandparents. So that is something that is taken from the placenta, the cord blood. We can definitely talk about it at length, but today I just want to thank ReeLabs for giving me this opportunity to do this. And once we finished it, you can ask us questions on this topic as well as stem cell banking. Thank you so much. So can we start?
Next slide, please.
No. Okay, yeah. So our topic is newborn sleep. Newborn sleep is something every parent has to be thinking about. The first thing that everybody will say is कि आपका जैसे बच्चा पैदा हुआ ना, आप नींद तो छोड़ ही दो, आपको ना नींद नहीं मिलने वाली. Well, उसमें that is some truth. There is some truth in it. For the first few weeks or possibly 2 months, you may go through this. But for, I'm just saying this on behalf of like parents who are pregnant and parents who are, have a newborn now, just take it in your stride. If you've got a new baby at home, a new baby is totally not knowing anything about the world. So, and the baby is only looking to you for guidance. So everything will happen, but it needs some time. So I wanted to actually start with a question. Next slide, please. So my first question is, how much sleep will a newborn have? The parents can, my participants, my members can definitely put in the chat. Let's see how much parents know. Saloni?
Yes, I've put my answer in. I hope I win.
So could you please tell me what all people are saying?
So my answer is 18 to 20 hours.
Okay.
We have someone who says 16 hours. Deepika Kumari says 17 hours. These are the three answers we've gotten up to now.
Okay.
Anyone else?
Yeah, anyone else?
No, I think that's it.
Okay, so as an adult, let me clarify this first. As an adult, when we sleep at night, what do we tell ourselves? Okay, I need at least 8 hours of sleep to function for the rest of the day, correct? Now, if one particular day I get lesser sleep, I say, oh my God, my sleep is not over. But when you are talking about a newborn, and when you're talking about 17 hours, you're not talking about like at least 8 to 9 hours at a stretch. That's not gonna happen. I'll tell you what will happen. Next slide, please. So this is when your baby is 1 week old. So many of you are right. Your baby will sleep between 12 to 18 hours or 16 to 18 hours. Great. But your baby in those 24 hours will get up at least 8 times, at least 8 times. And that is including the night. One, now this is the reason why. One, they have very tiny stomachs. So when they are born, their stomach is literally the size of a marble. So they can hold only that much milk, whether you're breastfeeding or formula. So they need to be woken up every 2 to 3 hours to feed. And plus, newborns will not sleep for like at least even 6 to 7 hours. They will sleep 2, 3 hours. Maybe get up after another hour or cluster feed. Cluster feed is when they're asking for feed every half an hour to an hour. That depends on baby to baby. So if you are expecting your baby to sleep for like 6 to 7 hours and you can rest, not happening for a few weeks at least. Second thing is they do not have any idea about day or night. Our systems are used to the night being for sleep, the day being for work or fun, but babies do not know that. So if you can see on the slide, trust me, for the first 1 week, just accept that you have to go through this. The next, please. Now, this is their behavior. Crying is the way babies communicate. That's it. They are hungry, they'll cry. They are feeling pain, they'll cry. They are sleepy, they'll cry. They'll be fussy. That is their way. That's it. They don't know the difference between day and night. They were in the womb for 9 months. For them, ever if it's bright, noisy, it's day. And by the way, I just wanted to share something with you that when a mother is resting, when she is pregnant, the baby is more active. Reason being, when baby is in the womb and in the day you're working, the baby is swaying in your womb. उसको अच्छी नींद आ जाती है womb में क्योंकि आप उसको झूला झुला रहे हो. पर जब रात को आप खाना खा के रेस्ट करते हो, आपका बेबी एक्टिव हो जाता है. तो आप सम if you can understand, this is how their cycle works at times. So first of all, baby doesn't know that. There is no established sleep wake rhythms like the way we say, okay, we'll sleep for an hour. Baby will get up if it wants to feed. Baby will get up if its eyes just open up. There are so many things. Mostly, yes, baby will sleep 12 to 18 hours, but it will be very difficult for you to see that your baby is sleeping more than 2, 2.5 hours at one go. They wake up to feed every 2 to 3 hours. Next, please. So this is how a baby's sleep cycle looks like. Now, if you see that, they'll first go into that soft, sort of, okay, quiet thing. They are asleep. They're trying to sleep. This will be a little quiet phase. Then they'll go into a deep sleep. Then slowly they'll come out of it. So if you see the whole slide, their whole sleep cycle is around 50 to 60 minutes. So that is what your newborn sleep cycle is. And a lot of parents do not know this. So they think that, why is my baby getting up every 45 to 50 minutes? Well, this is why. Next, please. We all tell our parents, put your baby to bed drowsy, but not like baby sleep cues are that, they are, when they are totally asleep, you put them on the cot and they'll wake up. And you'll say, I just put my baby to sleep. Why did it get up? There is a reason. So first, the baby, if it's got flushed eyebrows, is staring into space, just looking somewhere, not interested in feeding at all, even their hands start relaxing. When that happens, that means baby is ready to sleep. That is why we suggest that when you put your baby to sleep, put them while they are drowsy, not while they are asleep. So this is how a baby who's ready to sleep will look like. If you can see all this, please. Next, please. Okay. So anybody, any idea? When is a good time to introduce a bedtime routine for your baby? I have so many questions on this. Day one, okay. Next.
Participants, do post your answers. It'll be fun to see what each one of us think on this subject.
Exactly, exactly. It's okay. I mean, it's nice to be right. 1 year, 3 to 4 weeks, okay. In the womb? Oh, wow.
That would be interesting if we could train the baby in the womb.
Okay. Drew, I think you'll do it. So, what happens is in the first few weeks, it is very, very difficult to, uh, sort of say that, okay, I want to do a bedtime routine. In the first few weeks, you cannot introduce a bedtime routine because they're continuously getting up to feed after 2 or 3 hours. So even at night, they will be getting up at least 3 to 4 times. So your bedtime routine may be at 9 o'clock, but that doesn't make a difference. But slowly, slowly, the way baby, understands. And so by the time a baby it is at least a month and 1.5 month old, then you can start introducing, because that is where a baby is more aware. If you introduce this at 2 months, babies are more aware of things happening. At that time is a good time to introduce a bedtime routine. So sorry, Dhruv, not in the womb. Next, please. So there are many ways to settle your newborn. I have given you 10 tips. There are a lot of things. You can sing to your baby. You can, read a story. You can give them like a light bath. But we also suggest that it's preferable to give your baby a sponge bath till their umbilical cord drops off, and keep the umbilical cord place dry. But see to it that it's much better till you give them like a proper bath. So preferably a sponge bath. And also, I believe here dads can do a wonderful job, because the mother has to get up so many times to breastfeed. Dads can also talk to their baby, sing to their baby. And trust me, I'll tell you, there's a reason why they say that both parents are equally important. Because if the mother is feeding and taking care, the father has a very different relationship with the baby. And this is one of the ways that actually the father can bond with the baby. So, dear fathers, please don't lose this chance. So, as you can see, you can slowly start introducing these things, settle down with your baby, and then maybe sing, read, you know, do things like this, which sort of, make them feel better. Next, please. This is one of the things that I definitely speak in every presentation of mine on newborn sleep. SIDS is sudden infant death syndrome, which I'm sure a lot of people must have read about it. But it is something for which the cause is not known. We do not know why SIDS happen. There may be some factors which may be contributing to it, but exactly the unexpected and unexplained death of a healthy infant. Your baby is fine, your baby is feeding well. Why, God forbid, why does a baby, die of SIDS? Okay, it's extremely sad, and this is something that uh, we warn every parent about. So there are a lot of reasons in the sense there could be a lot of things which could affect this. I will come to that on the next slide, please. So first of all, did you know that secondhand smoke, like a family member, mother, father, smoking, and then handling the baby, is the number one cause for SIDS death? Please do not let anybody even smoke and come and handle your baby. Do not smoke and handle your baby. Do not let anybody else come and handle your baby. Because this is something that we always warn about. Next, please. Now, these are some of the things which could be the causes for SIDS. Okay. As you can see in this slide, there is smoking, definitely. Smoking is not at all allowed near the baby, or even if you smoke and come and handle the baby, is a no-no. It's an absolute no-no. Other thing that could be, something in the baby's crib. बेबी के पालने में कोई सॉफ्ट चीज रह गई जिसके ऊपर उनका मुंह मुड़ गया और वो सफोकेट हो गए, या क्योंकि उनको ब्रीदिंग अभी प्रॉपरली आती नहीं है बच्चों को, तो इसके लिए हम सजेस्ट करते हैं कि जो भी उनका पालना है, ओके, जो भी उनका क्रिब है, उसके अंदर प्लीज कोई भी सॉफ्ट टॉयज, कोई भी लूज मटेरियल, लूज पिलोज, लूज बेडशीट्स ना रखें. हमको डेफिनेटली बहुत क्यूट लगता है वो क्रिब में रखना, बट प्लीज वो ना रखें. उसके अलावा देर आर सो मेनी अदर थिंग्स. सो फर्स्ट ऑफ ऑल, लाइक if your baby who's not yet able to sort of work on their breathing and they turn, that is why I say put the baby always on the back. So SIDS is basically, you have to worry about it till the baby cannot roll over onto themselves. Babies are smart, they are capable, but they should have the strength to roll back once they feel suffocated. That happens around 3 months of age. Till that, you have to be very careful of the baby. Like the baby is kept properly. There are no loose things inside. Okay. You have to be very careful that the pacifier is not not hanging around your neck. There are so many things people say, okay, we'll just put it in the mouth. Don't do that. Next, please. This is how basically a crib should look like. The baby is on the back. The baby is in their own bed space. If you have put a sheet, you can see the baby's arms are out. The head is up, the sheet is still here, and the sheet is tucked in. The sheet is tucked in, it's not loose. So the baby doesn't get entangled in. So when you see this, this is how your baby should be placed. Next, please. There are a lot of people who ask me, I am staying in Delhi, where it gets very cold in winter. My poor baby will feel cold. Yes, your poor baby will feel cold, but then baby cannot tell you if the baby is feeling overheated. So you may have a heater in the room and you may have two sweaters on your baby. Now you may be okay with one sweater, but of course, being the parent, concerned parent, you will probably dress up your baby in a hat, in mittens, in sweaters. Babies are comfortable in 25 to 26 temperature. So you have to see that the heater is kept at those levels where the baby is comfortable. And if the room is warm, the baby will feel overheated. So that is another thing which you should be very careful about, because the baby should not get overheated. This is also one of the reasons why we suggest is what you should do is just add one layer more, one layer, because the baby can take maybe one layer more. That's it. Next, please. So when we talk about, the baby sleeping snugly, we all like our baby sleeping sweetly, cutely. But there are a lot of people who ask about swaddling. So nowadays you have these swaddles where you can see in the picture, the baby is put leg first, like this, and there is one flap and the other flap. So it is easy to swaddle your baby. Okay, so these are the steps. Now swaddling is easy. But first of all, when do you swaddle and when do you stop swaddling? You swaddle in the first few months. The reason being that baby feels as snug as she or he was in your womb or your stomach. Once the baby starts rolling over, okay, then you should stop swaddling. So these are some things that please keep in mind. So as you can see in the picture, this is how you swaddle. Next slide, please. This is how your swaddling should be. So this is a sleep sack. In this, if you can see, the baby, the sleep sack is still here, but the sleep sack should be in such a manner that the baby's head doesn't go inside. The baby should still be able to move its arms and legs. It shouldn't be bound. So this is another way of, swaddling your baby. But again, see to it that they still have room. And a lot of people and a lot of parents should actually stop swaddling if their baby doesn't like it. Swaddling is nice, but if your baby doesn't like it, you don't have to force your baby to do it. Next, please. Okay, again, quiz time. Let's ask this question. When should a baby sleep through the night? We all parents wait for that, don't we? So, any answers to this? Age 9 months, okay. 2 years, oh my God. 6 months, okay. Any more answers? So ideally, when you say sleep through the night, parents, please understand, we are not talking about 11 to 8. For a baby, sleeping through the night is 5 to 6 hours maximum. And 5 to 6 hours is slowly, when a baby is around 2.5 to 3 months, they will start sleeping around 5 to 6 hours a night, at night. Okay. So what happens is that is the time when we say, okay, you should start, because what happens is their stomach is growing now. They are able to feed more during the day. That is why they are able to sleep more during the night. That is the reason we suggest that please do not think that, okay, my baby will sleep through the night or at least 5, 6 hours. One, because they also need to feed. And after 3 months or so, they are able to feed faster and they are able to take more milk. That is the time when you can start expecting at least your baby to sleep for 5 hours a night. So understand the difference between an adult sleep and a baby sleep. Next, please. Establishing a bedtime routine. Every parent may have a different preference. Every parent may want to do something, which is calming, which is helping the baby. Some parents love to sing to their baby. Some parents love to give a massage and a bath. So every baby is unique, my dear parents, and every parent is unique. So what works for one parent may not work for the other. Please understand. Your baby may like something else. Your baby may like a story rather than a song. Your baby may like to feed to sleep. Your baby may love a bath before sleeping. So this is how it should be. Okay, you can have like a place where they have a place to sleep, their own space, you know, very soft noise. Some people also use white noise, which is called for their baby sleep because they feel that that helps their baby. Some people love to put on some music for their baby, give them a bath, change their diapers, change their clothes, so the baby knows it's time to sleep. Very soft in the room, dim lights, maybe your favorite lullaby that you're singing to your baby, or maybe some stories that you just read very softly. So anything which suits your baby. So it depending on how do you want to establish, you can start doing. Next, please. Next, please. Okay. I have a question over here. How many parents think that baby should sleep with them on their beds? And how many parents think that they should be given a separate place of their own? Anybody? Same bed? Okay. Okay. Separate cot. So, usually I have found in India that parents prefer keeping their baby and making them sleep on the same bed. Of course, we all are parents and we all love our babies and we'll take utmost care of it. So just to let you know, each to its own, of course, that Academy of Pediatricians, American Academy of Pediatricians say that the baby for the first few weeks or probably months, like 2 or 3, should be sleeping in the same room but a different bed. Like if there is a big adult bed, there should be a crib next to it. Reason being that you can look after your baby, feed the baby as the baby is getting up for 2 or 3 times at least in the night, but put them back safely in their own space. The biggest reason that they say is because of SIDS. Parents in the first few months are very sleep deprived. पेरेंट्स को बहुत कम नींद मिलती है क्योंकि वो लिटरली 24 घंटा अपने अपने बच्चों का ध्यान रखते हैं, अपने न्यूबॉर्न बेबी का ध्यान रखते हैं. But there are times when you may be so tired breastfeeding your baby or even trying to put your baby to sleep that you may just go off to sleep yourself. So this is the recommendation that you put your baby in a separate cot crib with a firm mattress, not a soft mattress, a firm mattress. But as I said, each parent is unique, each baby is unique. There are things sometimes when co-sleeping helps, and there are sometimes when a cot helps. As as I think Saloni said, right? That the first one was happy with crib, the second was happy with co-sleeping. So if you are co-sleeping with your baby, first of all, it should be a joint decision of the mother and father. I always believe that. Okay? It should be on a firm mattress. The mattress should be firm, not at all soft. Okay? You have to see to it that it's a big space so the baby can be sleeping properly. Okay? Be very careful when you are breastfeeding your baby. Okay? You see to it that if your partner even goes off to sleep, you see to it that baby is either put properly in the same bed, but sectioned, or put in a different. Plus, you have to see to it that you're not smoking near the baby at all. I have to keep on saying this because this is something that you have to keep on understanding. Another thing is that you have to understand is that there may be times, so no rockers, no chairs. There may be sometimes that the mother may put the baby here and put him or her to sleep. But don't let the baby sleep there itself. Or don't just lean on the rocker and no. Once that happens, baby sleep, please put them on a firm mattress and section them off. So when you take care of all these things, then your baby can safely co-sleep with you. But keep these things in mind. And again, as I said, no loose blankets, no soft toys. The space has to be clear of all toys, blankets, small pillows. Please don't put that. The baby will be very okay with having to just lie on their back on a firm mattress. So these are things which I would always suggest that all our parents take care of. As I said when I started, that these first few months are going to be difficult. Accept it. Moms, rest when your baby rests. It's not easy to do that, but try that. And that is how if you are sleep deprived, you will not be able to tend to your own baby. All these things, and trust me, this phase will pass. Our moms, whoever have now elder children, will know that this is a phase, but it will pass. So please keep this in mind. Next, please. Thank you. Thank you for listening to me. And this is my Instagram handle, Sushma Jethmalani. And I hope you really enjoyed this presentation. And you can ask your questions now.
Thank you so much, Sushma ji. This was really nice. And it was a lot of fun also, listening to so many things, learning so many things. It was nice seeing so many parents who've joined us today. So thank you to the parents who've taken out the time to be here. We have a ton of questions, so let's get to
Wow.
them.
Let's get to it.
So I think there was somebody raising their hand. Alpana Ganguly was raising her hand. Alpana, would you like to go first?
No, it was just answer for the question that where do you want to make baby sleep?
Okay, okay, all right, fine. We invite your questions in the chat box. Parents, please, just if you would like to ask the question, you can unmute and ask. Raise your hand and we can unmute you. Alternatively, you can post your questions in the chat box right now. Yeah, so we have Dame Mehta who's asking what is the ideal positioning in the last slide,
It's
please.
for breastfeeding.
Aha, okay, okay.
That is for breastfeeding.
I hope you got your answer, Mr. Mehta. He's asking, is it safe?
Yes, it is. There are a lot of mothers who can do that. Okay, it is a safe position. But as I kept on repeating, that you have to see once the baby is gone asleep, just put them on their back. Always keep on saying that. Put
Right.
them on their back. It is safe to feed.
Right, right. And we have Dhruv raising his hand. Yes, Dhruv, go ahead.
I just wanted to, sorry, one second. Hi, I'm audible.
Yes.
Yeah, yes.
I just wanted to ask, I know a lot of the responsibilities need to be shared by both parents, but it just often happens that the mother takes most of the responsibilities, especially when it comes to feeding. So as a father, what is it that we can do, to help out more, especially to help like the mother out, obviously with the baby as well, but also to help the mother out in the starting phases, the initial stage?
Frankly speaking, I think last time when I was talking about maybe breastfeeding or anything, you are a husband or a partner is one of the biggest supporters of the mom. So mom has to feed. We all know that, but there is something known as diapering. There is something known as changing the baby. There is also something known as if the mother is, for example, like the mother is too tired and she just pumps breast milk, so if the baby gets up in the night, the father can take over. The father can feed that pumped breast milk to his baby, and the mother can maybe sleep for another 2 hours. So there are so many ways, and also the fact that I believe that a lot of fathers can this way bond with their baby, because the baby starts recognizing the father or the partner as a primary caregiver. So slowly, when the baby recognizes you, they recognize that, okay, this is the person who has been taking care of. So you actually make your own bond with your baby.
I would like to elaborate on this. I think my
Yes.
suggestion to the father would be that if we talk about a nighttime routine for the baby, the father can pretty much do the entire routine other than the feeding bit if the mom prefers to breastfeed. So I feel the father can take over the nighttime routine and probably have the mom just breastfeed. Allow the mom to, sit back at that point of time, knowing that her baby is well taken care of. The mom can probably do a bit of a nighttime routine for herself while the dad is taking care of the little one. So this allows the mom to be in a better headspace to take on the night. Also, probably if you know that your wife has been awake the whole night nursing and changing, then perhaps get your few hours of sleep and take over the morning routine and let her sleep in a bit. Try and ensure that there is a little basket of things that she needs through the night lying right next to her, probably a drink, some nutritious snacks, bottle of water. Just ensure that she's comfortable so that she can take on the whole night after that. So there are little things I feel, as the more you're available, the better you become at it. And then you can just tag team and work together as a team and make this phase a little easier on each other. That's my take on it.
Well said.
And we'll take this next question. We have Pooja who wants to know till what age is SIDS a risk? Can we put a pillow on the baby's legs so that it doesn't wake up moving legs a lot? Is it okay at times kid sleeps for 6 hours without a feed. I think, Pooja, your baby is under 1 month as far as I know.
15 days old, because I know
15
Pooja
days.
has been asking us
Yeah.
questions from the hospital.
Yeah. So, the 6 hours without a feed is not
No.
okay. I'll let Sushma take on the rest, but it's a gentle reminder to all parents for babies. I think under their 2 months of age, the gap between the feed should never be over 3 hours, in my opinion. From personal experience, I feel it's not a good idea. Once they are past a certain birth weight, which your pediatrician will guide you and Sushma ji will guide you, then it is okay for them to take a longish nighttime nap once in a day. Otherwise, they have to be fed every 2 to 3 hours. I'll let Sushma take over now.
Saloni, whatever you said is correct. Okay. I don't need to repeat that. What I will say is that, Pooja, your baby is just 15 days old. As I kept on saying, even in the presentation, that your baby's stomach is very, very tiny. If they can hold only this much milk, okay, they are going to get up to feed. And we also suggest that if your baby is not getting up around 2.5, 3 hours, please wake up your baby to feed. Because in the initial months, your baby's growth is very fast. They need to keep on feeding. Okay, they need to be able to get calories. So that is why you have to keep on feeding them.
बच्चे के बारे में बता रही आंखों दिन का अभी आज पहली बार देख रही हूँ मैं तो
Somebody's mic is on. If they could just turn it off, please. Sorry, go ahead, Sushma.
Yeah, and another thing, no, you should not be keeping pillows on your baby's legs. We do not suggest that. I think I've already,
I think because I understand what her question is with respect to, kids getting, they keep jerking, like they,
So-
they jerk
yeah,
in their sleep.
So here what she can do is she can try a swaddle.
Correct. So I think a swaddle is a better technique. It's been used for generations now. Even our grandmothers, mothers, great grandmothers have taught us how to swaddle. Swaddling can safely be done up to your time that your child starts rolling over. So I think we recommend swaddling. So you could perhaps read up more about on that, but the pillow is a big no-no in our opinion. We'll
Next,
go
please.
on to the next question, which is she's asked that question a couple of times actually.
Okay.
Chewing
So,
hands is a sleep cue or feeding required cue?
come again.
Is the chewing of hands a sleep cue or a feeding cue?
Chewing on hands.
Yeah.
Chewing on hands. How old is the baby?
Same, it's Pooja only.
Okay. So at the moment, the baby is trying to suck on their hands and all. So their baby is hungry. It should be mostly hunger.
Yeah, for a baby that small, it is
Uh-huh.
probably hunger. Deepika Kumari wants to know, what if the baby doesn't like swaddling? What is your suggestion on that?
I did suggest that if your baby doesn't like swaddling, you don't need to swaddle.
Yeah. Like for me, my older one hated swaddling. I could never swaddle him. The younger one loved her swaddle, so we could carry it on till 3 months of age. So
I said in the end that every baby is
every
unique.
baby is different.
Parent is-
Yeah. Yeah, do what works best for you. Of course, follow the guidelines, but do what works best for you.
That is the reason on my last slide, I put co-sleeping,
Correct.
because a lot of people in India do that.
Correct. Correct. Correct.
Okay. And then it is important for them to understand what is safe and what is not safe.
Correct. So I used to co-sleep with my younger one, but we had a separate dedicated firm mattress in between for her, which was just her mattress with no loose covers, no pillows, no nothing. So that was
Exactly.
her dedicated safe space and a safe sleeping space. And technically we co-slept, but she would always be on that mattress. Like she would never be
So
taken.
again, it was a sectioned off place.
Absolutely. Absolutely. It was never that she was inside my blanket or anything like that. That's a big no-no. So
Yes.
co-sleeping does not mean that the baby's inside with you in a blanket. That is a little dangerous for young ones. Alpana wants to know, my baby is 9 months old now. When he tries to turn, he either sits or cries or starts scrolling. Is there anything I can do? This is so common, when babies are learning new skills, they are practicing it in their sleep,
No, you can't do
unfortunately.
anything about it.
You can't. It's a phase, Alpana. I promise he will grow out of it. I know it is so
I
tough.
mean, see, actually, that's let's put it that way in a positive manner. That Alpana, that's a developmental milestone.
Yeah. Yeah. They are just perfecting their crawls and their soon
Exactly.
walking and all
Now
of that.
slowly they'll do their first steps. They'll start
Yeah.
walking. So
Yeah.
this is something that's natural,
Yeah.
and you should be happy because your baby is doing that.
Yeah. I used to just to deal with this, I would never turn on the lights. I would never talk loudly. I would just continue to make the baby realize it is still night time. I think they
Exactly.
go back to sleep faster.
Yes.
Kesava wants to know, suppose if mother feeding is not enough to baby, can we use mother baby milk powder? I think she means formula. If breast milk is not, this is technically not a sleep question, Kesava.
I'll still answer it.
Yeah.
So it so happens is that a lot of mothers feel that the milk is not enough. Okay, and I keep on saying this. Please understand. One, if your baby's weight is growing according to the chart given by your doctor, if your pediatrician says that your baby is growing fine, believe them. Because if the weight is not increasing of the baby, the doctor will tell you. Correct? So if you've given a chart, you can see that your baby's weight is growing properly. That means your milk is enough. If your baby is underweight, that only if, then please talk to your pediatrician for a formula. We cannot recommend from here, but talk to your pediatrician. And another thing is, if your baby has, if you so there are little things. Your baby is comfortable. Your baby is playful. Your baby has enough wet nappies, dirty nappies. All of these things means your baby is getting proper nutrition. So does that answer your question?
My input on this is that also remember that each baby's weight is determined by the genetics of the parents. So
Exactly.
every baby's size will also depend. So there is no specific weight that 5 kilos means healthy, 2 means unhealthy. No. Each baby's weight is mapped or charted by your pediatrician depending on a lot of factors. As long as a qualified pediatrician feels everything is okay, you need to trust them. And in the first few months, it is the pee count. Baby is active and alert when they're awake. These are indications the baby is doing well. Post which the baby's milestones and everything come into play. So it's best to always stay in touch with a qualified pediatrician to map the weight in the first few weeks to understand whether the feeding is going right or not. I think the questions have ended. So we'll probably yeah. So we have Sushma ji's Instagram handle. So do follow her on her Instagram handle. She posts a lot of interesting content on that. We have a last question. My baby
Yes.
doesn't wake up for 4 to 5 hours once she sleeps, and she wouldn't wake up unless she wants to herself. Is there a specific method I can use to wake her up? You need to specify the age of the baby, Harshada.
Exactly.
We do not know because the answer would change depending on the age. Until then, everybody else, these are all the links to reach us, to reach Sushma ji. You can book a consultation with her and, just ask all your questions. Okay, Harshada's baby is 22 days old.
Yes. So then you have to wake up your baby every 3 hours at least. Okay.
Yeah.
And so there are a lot of ways to do it. So if you're swaddling your baby, unswaddle them, remove the swaddle, right? Because as long as they are swaddled, they'll be sleepy, they'll be in their deep sleep or whatever. Unswaddle them, maybe open up the curtains, get a little light in, take a cool, not cold, cool, wet cloth, clean cloth, and just, maybe, you know, wipe their face, wipe their hands, slowly, slowly they'll get up. So these are some of the things that you can do. Maybe, get her to a place like, uh, where there is a little bit of noise. Okay. There's a little bit of light. There's somebody speaking. So slowly, slowly, all of these things will help your baby to wake up. But do wake up your baby. Please, at least 2.5, 3 hours to feed them.
Yeah, I agree. It has to, you cannot, I know it's easy for us to let them sleep. We are so sleep deprived, we're so exhausted. But for the welfare of the baby and the mother, the baby must be woken up every 2 to 3 hours until such time the baby has regained birth weight. And post which, still, I would say continue 2 to 3 hours up to the baby's, I think, second month birthday at least, I would say. And
Yes.
also some things like you could also bring the baby to the nipple. Sometimes they can sniff and they kind of get a little awakened with that also. You could try what works for you, but Sushma ji,
Actually, another thing, Saloni, what you can do is that if you have a slight pumped breast milk with you,
yeah, yeah,
okay, bring it on the
yeah.
baby's lips.
Yeah, because instinctively they will then try and get up, but
We'll try to
do
get.
not let them nap for so long because they will not be able to regain birth weight. They'll become lethargic. You might start feeling my baby is a good sleeper, but actually it's the baby has no energy to get up and ask for a feed. So we shouldn't ever get to that stage. Yeah, so
I
I
would
think
like to add in the end on this that a lot of parents, please keep your vaccinations up to date, okay, for your baby, and also your postnatal visits for your baby to get their, to get things checked properly, to see if the baby's weight is, gaining properly and everything. Because these are the things which will, I think, help you understand that your baby is growing properly. And also, there is a lot of anxiety which can be, sort of taken away from you because you are not worried about it. You've gone for your postnatal visit, you've seen, if the doctor says everything is fine, then you are much, much more relaxed and not worried about your baby.
absolutely it'll give you more confidence that what you're doing is right. And that is so reassuring, honestly, in the initial few weeks and months.
It does.
Yeah. So we have all the information posted about ReeLabs in the chat box. You can just take down the links if you want to. And also the link to Sushma ji's Instagram handle. We will end this webinar now. A big thank you to all the parents who joined us in large
Thank
numbers, even though there's a very interesting match happening, but still you took out the time to get to us and be a part of this lovely webinar that we have curated just for you guys. And thank you, Sushma ji. It's always a pleasure hosting you here. And we look forward to the next one soon. Thank you,
I
Dhruv.
love
For your
talking to
technical
our dear
support.
parents.
Yeah, thank you. Thank you, everybody. Thanks, everyone. Everybody can log out now.